Do you have a herniated disc and now wondering if you will ever be able to run, work out, play with your kids, or even sleep without pain again? Is this a death sentence? I get this question almost every week in my clinic. Can I still live a full life with a herniated disc? Let me tell you a quick story. We had a patient walk into our office who was terrified because their MRI showed a massive herniated disc at the L5-S1 level. She had been shut down for 2 months doing physical therapy and other things, and she was making no progress with all the advice that she was getting from the healthcare providers. She was thinking surgery was going to be her only option, and even was thinking, could she even get back to an active lifestyle without having back surgery? And the answer is yes. Today I'm going to break it down on what a herniated disc really means, not just what the MRI says, what research says about healing and living a pain-free life, and whether you can truly live a full active life even with a massive herniated disc. So like I said, this patient had a big herniated disc, and she had all these fears because you go to the doctors and it's like, oh, there's nothing that you can really do. We can do injections. We might need to have surgery. And she was hearing that I wouldn't do surgery at that level because it's not great. And maybe she's going to need a fusion. And then she starts Googling, and she's been to this physical therapist and this physical therapist, and no one is really matching on like how to solve this problem. And so there is a lot of fear with this. There's a lot of fear in her mind. And so when you have something that is like as big as it was, as far as a herniated disc, you can totally heal from it, and you can get back to everything without having any problems. And so let's go into that big herniation and talk about it. So when we have our discs here are bones and here's our disc. And when that herniation is really big in the back through here, really big, it was hitting on her nerve. She had pain down her leg. She had, her strength was reduced. There's all the things that was related to having a pinched nerve. And so when it is so big, you can literally, as you start doing a little bit of extension, you can actually press into that nerve and it pushes further into the leg. And so we know this because if we start going into extension, it's like, nope, pain down the leg, nope, pain down the leg. And so you can't do that. So what do? Essentially, we want to kind of almost open up the space a little bit, and we use gravity for that disc to kind of slowly come down. This is why the first 2 weeks is so slow. And I told her it is going to be painfully slow. You're going to feel like you're not making progress. I go, but when we can get you over the hump, then the progress is much faster. And so it was painfully slow. I'm like, you're going to have to be in this position a lot. In order to open that space up, in order to use gravity to go down. She was just gonna have to shut it down. And so the exercise that we gave her on doing this was pillows. So we used pillows to lie over. And so essentially our spine is like this. We're in a little bit of a flex position. And then that's just allowing space where that herniation is. And then we're just allowing, in the middle of the disc, it's kind of like gel filled. We're just allowing that gel and that disc to slowly move down. That's why it is such a slow process. That's why you're doing it all the time. So we had to start out like this with her, where she was lying over on her stomach in a little bit of a flex position. Now, how do we know how many pillows that we need to use for her? Well, when she lied there and her symptoms went away, that's how many pillows. She started feeling good. Her back actually started feeling better. That's how many pillows that we used for her. And that was her homework that she had to do again and again and again throughout the day, as much as she could on the weekends, hang out in that position as much as she could so we can get her over that hump. Now, that was one piece of it, but the other piece of it is the lifestyle piece. And this is where people didn't give her any education, because lifestyle is huge. And so we have to ask, what is your work situation? Okay, sitting is bad. I can't do sitting. Great. Okay, so we're going to adjust how you sit, or maybe you're just going to have to stand and work, which is what she had to do. She had to stand and work. Sitting, she couldn't do it at all. And driving was the worst. And so we gave her ideas around how she could stand. We gave her ideas where she could put like a knee on a step stool to give her a little bit, take a little bit of the pressure off that off the back. Sleeping was another one that no one gave her education on. I'm like, she's like, I heard every morning I wake up. I'm like, oh my gosh, how are you sleeping? I sleep in the fetal position, where she was like all like, her knees were up to her chest, lying on her side. I'm like, you can't do that. We've got to stop that. So as soon as we were able to stop that, she started making progress. But no one gave her education as to why and what position that was going to make it worse and positions that were going to make it better. And so that was what we did. That was her first 2 weeks of what we did. Now, she came back in after a couple weeks of doing that, and we were able to really push her. Like, I was like, look at this. Like, we can actually go press up. She would feel a little of a pinching in her lower back. I'm like, fine, do it again, do it again, do it again. How's the pinching? It's getting better. Perfect. No symptoms in the leg at all anymore. But she was still having issues with sitting. And I was like, interesting. So we went into her hip, because again, you can have back issues and hip issues. You can have a combination of things. And that's kind of what happened with her. And so we noticed that like, oh, that one side was not moving. And so we had to go into getting her hip to start moving and doing some hip mobilizations so that we could get her back to sitting and feeling better. Now, the other guidance was like what she could do, because she's a super active person. So you're going from someone that is active, they're socially active, like meaning that they go on bike rides with people, and that's part of her social life as well. So you're taking social away and you're taking exercise away, and that's not good. And so her biggest fear was, am I going to be able to get back without having like fully backed with cycling, all these things without having issues? I'm like, yes, absolutely, 100%. Like, we see it all the time. People come in and they're making progress. As long as she's making progress every week, she's making progress. Now we have people that come in and they kind of plateau and they stop making progress, and they start getting a little bit worse and a little bit worse and a little bit worse. Like, okay, yes, we need to send you off to go to go see a surgeon, to go get maybe some imaging. That's when imaging is like, okay, yeah, let's go do it. Let's see what's going on. Sure enough, there is a cyst or something that has formed in their spine. I'm like, yeah, you got to have surgery for that. We can't help you with something like that. But that is where an MRI is something that is useful. A lot of times, if you're using an MRI to let's see what's going on, it's not helpful, because you can have 100 people with no back pain whatsoever, and 60-80% of them are show herniated disc degeneration. The space is getting smaller, and so we can't use that information as going, okay, yeah, that's what's going on. She wanted to use an MRI to go see, let's see how much healing they've had. I go, does it matter? You're getting better. Like, an MRI is just a waste of your money, because it's not going to tell you if you've healed or not. It may show that you still have a pretty big herniation. So we've got to look at all of these things to help them get back to feeling great. Here's the truth. A herniated disc does not mean your life is over. You just need the right information and the right plan. If you want help figuring out what movements your back actually needs, or you're tired of being told to just rest, send me a message or comment disc below, and I'll send you a free low back pain guide. And if you found this helpful, hit the like button, subscribe, and share this with someone who's scared because of their MRI. They need to hear this. You can live a full active life even with a herniated disc.